Welcome to another episode of The Liver Doctor Simplified. In this episode, we'll be speaking on a very important topic about how alcohol affects women when compared to men. I think this is a topic that has not been discussed in detail in most of the videos that I have seen before. So I thought maybe we can deep dive into this conversation and understand what alcohol can specifically do to women when compared to men. So the first point that we need to understand is what happens to alcohol in our body. So when you consume alcohol, a very small portion of that, about 2%, is absorbed in the food pipe. A little bit larger proportion, about 22%, is absorbed in the stomach. But most of the alcohol absorption actually happens in the small intestine. So about 75% of alcohol gets absorbed in the small intestine. Now, what happens with this kind of absorption? Because this absorption is quite quick and alcohol enters the blood very quickly after initial consumption. So, most of the tissues in our body, most of the organs in our body are exposed to the same alcohol concentration as the blood because most of the alcohol absorbed directly goes into the blood. So, all the organs are bathed in this alcohol after you consume it. And this happens across all the tissues and organs at the same time. Now, once alcohol enters the blood, it is a poison. So the body wants to actually get rid of it. So this is what happens. There are, at the cellular level, there are two pathways. One is a non-oxidative pathway, a small pathway, but the bigger pathway is the oxidative pathway. So in this pathway, alcohol is converted to a metabolite known as acetaldehyde by the enzyme known as alcohol dehydrogenase. So most of this alcohol dehydrogenase is actually, some of it is in the stomach and most of it is in the liver. So liver is the major organ that is going to put out alcohol away from the body and convert it into a neutral substance which does not harm the body. So that neutral substance is acetate. So acetaldehyde is poison. It is the most toxic component of alcohol metabolism. And acetaldehyde, once it is formed, aldehyde dehydrogenase, an enzyme, actually breaks it down into acetate, which is neutral, and then it's taken out of the body. But if you consume excess amount of alcohol, very high amounts of alcohol, then that excess alcohol again gives rise to higher amounts of acetaldehyde, and that acetaldehyde excess is what causes fat deposition in various organs, inflammation, and also scarring. So the excess consumption leads to all of these conditions that I have mentioned on the side here in the red box. There is alcohol-related fatty liver, alcohol-related steatohepatitis, which is a very dangerous condition where excess accumulation of fat in the liver and due to alcohol's presence leads to drastic and sudden damage to liver cells and liver failure, whereby patients suddenly presents with jaundice and liver failure, which later progressed rapidly to multiple organ failure. So that can happen with heavy drinking and then alcohol cirrhosis in the long term. And also the last part, that is HCC, which is basically liver cancer. Primary liver cancer can also form because of this continuous alcohol use that leads to lipid accumulation, inflammation, and scarring. Now, what happens to this particular alcohol metabolism in a woman's body? So it's very important to realize that for equal alcohol intake, women develop higher blood alcohol levels when compared to men. So this is because of various reasons. So number one is women typically have decreased body weight and have decreased body water. So the volume of distribution of alcohol in the body is low, which means larger amounts of alcohol can be absorbed faster in the woman. Now women have lower levels of this aldehyde and alcohol dehydrogenase enzyme that I spoke to before, which breaks down alcohol. So they have decreased stomach levels of alcohol dehydrogenase and reduced gastric emptying, that is reduced stomach emptying of alcohol into the small intestines, which means that larger amounts of alcohol are getting absorbed into the body even with lower levels of drinking. Now, women have estrogen, that is a female hormone, and studies have shown that, especially in animal models, that estrogen increases liver injury. So, the presence of estrogen, increased estrogen in the body, increases liver injury in the presence of alcohol. Now, women also have higher growth hormone levels with alcohol consumption, and this has also led to increased acetaldehyde deposition in the liver, and this is after metabolism. So There is increased accumulation of acetaldehyde, that is the toxic metabolite of alcohol in women with lower levels of consumption that leads to liver injury. And ultimately, the whole inflammatory response in a woman is much, much higher and quicker than in a man when it comes to alcohol use. Now, what does this mean from a woman's liver perspective? So, women develop with a lesser alcohol exposure, they develop more severe liver disease and suffer worse disease consequences compared to men. Consumption of one drink per day as compared to long term abstinence. So, imagine a woman is consuming just one drink a day. This is associated with increased risk of cirrhosis in women, but not in men. This is so important. So even one drink per day can affect the woman and lead to cirrhosis when you compare it with men who drink similarly. The risk of development of cirrhosis was consistently higher in women than in men with all levels of consumption. So at any levels of consumption, just not just one drink, even less than one drink a day, two drinks a day, any levels of consumption, you look at women and men, women are more prone to developing cirrhosis of the liver with alcohol use. Now, younger patients, when they get affected with severe alcohol-related liver disease, so that is this condition known as acute on chronic liver failure, where a chronically damaged liver because of alcohol suddenly fails because of alcohol-related hepatitis, which we spoke about a few slides before. That leads to sudden liver failure. So the younger patients admitted to hospitals because of acute on chronic liver failure driven by alcohol use are most likely to be women and not men. Now, women have increased hospitalization rates, that is about 33.5%, compared with an increase of only 14.7% as seen in men with alcohol related cirrhosis. So, not just cirrhosis development, but the severity and complications associated with cirrhosis is also higher in women when compared to equal drinking or equal level of degree of liver disease in men. Now, the whole aspect of liver being the central or the focus of this discussion in a woman is that for any given level of alcohol intake, women had a higher relative risk of developing alcohol induced liver disease and alcohol induced cirrhosis compared to men. So, if you look at this study, they actually showed that uh, even though women consumed less amount of alcohol, that is, they received 12.5% less alcohol per kilogram of body weight compared to the men in the study, both genders achieved equal peak of alcohol concentration in their bodies. So even with lesser consumption, women had actually as high alcohol level as men who consumed much more than them, which means that even with low levels of consumption, women are at very higher level of developing severe liver disease, and this is very important for women who even drink occasionally. Now, the risk of liver cancer, which is medically known as hepatocellular carcinoma, is 5 times higher in women than in men per the same amount of alcohol consumption. So, if they are drinking equally, the men and women they are drinking equally, the risk of liver cancer was actually 5 times more in women compared to men. And hospitalizations due to alcohol-related cirrhosis and alcohol-related liver disease has been increasing since the last few decades, more in women than in men. So this increase, as per this study, was 19.8% from 2017 to 2014, and the increase was most significant in women than in men. That is, 33.5% of these were women with severe liver disease, and 14.7 was only men. But and the whole aspect is that they were drinking equally, or the women were drinking much lesser than men. Now, um, daily alcohol consumption in women, of course, leads to severe liver disease, but then there is a small catch here. So, one study showed that when women were consuming daily alcohol, in addition to not consuming alcohol with meals, this was actually associated with an increased risk of cirrhosis. So when women just drank alcohol but then did not drink this alcohol with a meal, they had a very higher risk of developing, that is double the risk of developing cirrhosis. This does not mean that women should drink along with meals and they're protected. It does not mean that. It just means that in the absence of a meal, alcohol related toxicity is much higher in women, and the development of cirrhosis is much higher in women who just consume alcohol but eat less. Now, a study found out that 4 of 7 women who abstained from alcohol developed cirrhosis within 1 to 2 years compared to 0 of 6 men, which means that when women become sober, they drink for a long time and then they become sober. Even after becoming sober, the development of cirrhosis was much higher in women compared to men. I think this is quite tragic because being sobriety is one of the most important aspect of, uh, you know, halting the progression of liver disease when it comes to alcohol related liver disease. But in women, even this is not that great. Being sober after a period of alcohol intake does not guarantee that these women actually can reduce their development of cirrhosis when compared to men. So even sober women who have drunk significantly in the previous years, they have a higher risk of development of cirrhosis even after stopping alcohol. And I think this is so important that the best practice here is to not drink at all, if you're a woman. Now, there is another study which showed that apart from being a woman, being overweight was associated with the development of a severe liver disease known as alcohol-related steatohepatitis or alcoholic hepatitis. It's a terrifying disease of the liver. We have seen many people die from it because you don't get enough time to work on them, and the way this disease progress is so rapid that the patients end up short period of time. So I think it's very important for us to understand that being a woman and being overweight and with alcohol, I mean, this is like very, very heavy risk of development of severe liver disease from which sometimes there may not be a comeback. Now, if you look at a non-liver perspective, and I think this is some important data that we have here, which women and girls are most likely to binge drink? So, women aged 18 to 34 and high school girls were found to have higher risk of binge drinking. So, binge drinking is somewhere around 5 drinks in 2 hours in men and 4 drinks in 2 hours in women, and that's basically rapid drinking. And these are standard drinks, which means that one drink contains 10 grams of ethanol, that is pure alcohol. Now, if you look at this second image at the bottom, you can actually see that binge drinking among high school student girls has been actually increasing. And in grade 9, 45% of children were binge drinking, and it actually increased to 62% when they reached 12th grade. So this is very important because we don't talk about this. We are talking about alcohol use disorder in men all the time, but we are not talking about the elephant in the room, which is an increasing use of alcohol among women, especially younger ages, and also in children. Girl children drinking much more. They're doing binge drinking, and they are not just at the risk of developing liver disease, but also non-liver related complications, which we will again come to in the next few slides, but including cancers. And this is something that we need to prime with respect to our daughters. I have two daughters, very young children, and it's important that we talk to them regarding harms of alcohol once they are at an age where they are at risk of being exposed to alcohol. And it's important that we make them understand, and a preventative kind of therapy is actually more important than actually damage control. So please talk to your girls, talk to your daughters regarding how alcohol can be very harmful, and why younger women should stay away from alcohol use, because they can have much higher or more severe consequences of alcohol at uh, older age. Now, if you look at other issues with alcohol in a woman other than the liver, so you can see that women are more susceptible than males to development of cardiovascular disease, that is heart disease, brain disease, cognition and memory defects, hangovers, and certain cancers. So the risk for women and girls with alcohol use is that they develop more of injuries, for example, motor vehicle crashes, falls, drowning. They are at the receiving end of more violence. I'm not saying alcohol is the only factor there, but alcohol is one of the important factors where homicide, suicide, intimate partner violence, sexual assaults are all indirectly affecting the women. They are at higher risk of developing many chronic diseases, lots of types of different types of cancers, including breast cancer, which we will again discuss in detail. They have very poor reproductive health, women who drink. So that leads to unintended pregnancies, sexually transmitted diseases, consequences in a would-be mother because of alcohol use, and poor infertility, or poor fertility and infertility in women can also be driven by alcohol use. So the dependence on alcohol, or alcoholism as we used to call it previously, is much higher in a woman as when compared to men. So women are more likely than men to experience hangovers and alcohol-induced blackouts at comparable dose of alcohol. So even with lesser drinking, women can have more hangovers and more blackouts when compared to men who drink the same, or when compared to men who drink the same. Now, women compared to men had larger increases in alcohol related emergency department visits, hospitalizations, and deaths in the past 20 years. So, women are at the really severely receiving end of alcohol use disorder when compared to men, if you look at the last 2 decades. And alcohol use disorder is something that you need to understand. It is characterized by an impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. So, socially, financially, physically, mentally, people get affected when they keep consuming alcohol, and that disorder is known as alcohol use disorder. And that requires treatment. If you treat alcohol use disorder, you can prevent downstream effects of alcohol related organ failure, organ injuries, and other consequences. But this is so important that women are less likely than men to receive treatment for alcohol use disorder. And this is mostly because women do not come out and talk about it in the open, or women are not considered important enough for our society to look into alcohol use disorder and substance use disorders, to elevate them to a position where they are going to be in control of their life and health, and they are neglected in this particular situation. And I mean, if you're watching this and if you have a woman in your family, or if you are a woman who has problems with alcohol use, please come out, talk to your friend, talk to your family, talk to the person who will look at you, treat you, advise you, and suggest actions, putting you at the center of everything, so that you can gather help, take care of your health, and take control of your life. So it is important that women come out and talk about being uh, you know like we call addicted, or suffering from alcohol use disorder. It's important that you come out first, because only if you realize that it is harming you, if you have the insight that it is harming you, only then we can come at you with good help, support you, treat you, and get you better. So, even though women are less likely than men to receive treatment for alcohol use disorder, I think we need to change this and help women come out of alcohol use disorder out in the open. It is nothing to be shameful of, because alcohol use disorder is actually a disease. It is not something that you have chosen to live with. It is a disease, and all diseases require diagnosis and treatment. So consider this as a disease and come out and speak to your the best friend, best family member, your best half. Talk to them and come out in the open and discuss openly, so that treatment can be offered and you can get back the control in your life. Most importantly, women are more susceptible to alcohol related heart disease than men, even though they consume less amount of alcohol over a lifetime when compared to men. So sudden cardiac deaths, heart related deaths in men that we see, I mean, same things can happen in the women at a much larger range, and even with lower consumption of alcohol. So the whole aspect of alcohol and the liver is now completely going out of focus, and you can actually see that it's not just the liver that we need to address. It is so many other things that we need to address when it comes to alcohol. For example, this part, so important: alcohol produces brain damage, anxiety, depression episodes more quickly and more severely in women than in men. Alcohol produces more severe brain size reduction, which is known as brain degeneration, and more reduction in the size of important areas in the brain, which is involved in memory and decision making in females when compared to males who drink the same. So, a lot of brain related functions are severely affected in women with lower levels of consumption of alcohol when compared to men. Now, there is something known as memory consolidation, that is, transfer of short term memory to long term storage. You have some good memories that you want to keep recollecting over your lifetime. That is known as memory consolidation. So that transfer of good short term memories to long term storage is affected in females much more than males who drink equally when it comes to alcohol use. And even with lower levels of consumption, this can be severely affected in women. That is, memory consolidation can be severely affected in women even with lower levels of alcohol consumption. Just imagine if you cannot make new memories. I mean, that's as bad as worse as dying if you can't make good memories. And alcohol does that to women much more than men. Even one drink a day can increase women's risk for breast cancer by 5 to 15% compared to women who do not drink at all. So the best dose or the best level of alcohol for a woman is actually zero. because even one drink per day can increase the risk of breast cancer when compared to women who do not drink at all. So the best option is to not drink at all. Now, the higher risk of osteoporosis, which is damage to the bones or poor bone health in women, reproductive diseases, including irregular menstrual cycles, ovulation, infertility, are all alcohol-related in women, and it's directly associated with alcohol use in women, and these are all well proven and documented. Now, it's important to realize that when we talk about alcohol, we mostly talk about the liver, right? So they'll say that my liver function is fine, I feel fine, I'm okay, I'm still drinking a lot, so nothing's going to happen to me. But it is not the liver that we need to focus on, it is the cancer. So alcohol is classified as a group 1 human carcinogen, that is a cancer causing substance, by the IARC, that is a part of WHO. It is causally, that is, it's not a correlation, it is not a link, it is directly causally, it causes this, linked to 7 types of cancer. Besides female breast cancer, it increases the risk of developing mouth, throat, foot pipe, liver, voice box, and large intestine and rectum cancers. So it's not just liver cancer you're worried about or breast cancer. There are so many types of cancers that are directly linked or caused due to alcohol consumption. More than 10% of alcohol attributable cancer cases arise from drinking just one bottle of beer, that is about 500 ml, or 2 glasses of wine every day. So people who think that wine is a lesser evil form of alcohol and consume 1 or 2 glasses of wine a day, thinking that it is going to improve their heart health. No, it is not. More than 10% of alcohol attributable cancers arise with even this level of low drinking. So please be careful about this. So there is no level of alcohol that is actually safe. For breast cancer, specifically in women, this is even higher. That is 1 in 4, that is almost 25% of alcohol attributable breast cancer causes are caused by this level of low drinking in women. And it's not just heavy drinking that is going to put you in trouble. Even low levels of drinking is going to put you in trouble, especially if you're a woman. So when you look at the data from Europe, there are 7 out of 100 new breast cancer cases in Europe is directly linked with alcohol use. And alcohol is the reason for more than 40,000 new breast cancer cases every year in Europe. So this is huge numbers. So let me just point out this important aspect. I have also highlighted this with in this particular slide so that you are aware of what I'm talking about. Some important points on alcohol and breast cancer. So there are some things that are out of a woman's control when it comes to cancer, breast cancer, and one of that is age and genetics. So age of a woman and genetics actually are one of the most important risk factors for breast cancer development in women, which we cannot control because we age and our genetics is fixed. But alcohol consumption is a factor that a woman can actually control. So if this is controlled well enough, the risk of breast cancer in a woman reduces drastically. So research indicates that even 10 to 15 grams, that's less than 1 ounce of alcohol each day is associated with an increased risk of breast cancer. And a 10-gram increase in alcohol consumption, that is one standard drink per day, increased risk of breast cancer in premenopausal women by 5% and postmenopausal women by 9%. So just one drink a day increment, if a woman consumes alcohol with just one drink increment every day, it increases the risk of breast cancer by a large margin in premenopausal as well as postmenopausal women. And this is so important because this is the data that we are, which is most important for our discussion here, that there is no safe level of alcohol. There is no low level of alcohol which provides any kind of health benefits. This is what this slide is telling us. And light drinkers have slightly more than one-fold increased risk of breast cancer compared to non-drinkers. So people will say, or some women will say, no, I drink only socially, I drink only on weekends. But even that has an increased risk of breast cancer development. With heavy drinkers, the risk increases more than 2 times. No, almost 2 times the risk of breast cancer increases with heavy drinking women. Now, how does alcohol affect women indirectly? And I think this is a controversial slide, and I understand that many people won't understand what I'm trying to say. But what I'm trying to say here is that women are at the receiving end of a lot of domestic violence, partner crimes, etc. Mostly because in most of these cases, there is some alcohol that is featured. So, alcohol and assault, about 50% of sexual assaults involve alcohol, and this is from data from the US. And 65% of women abused by their partner report that their partner used alcohol before the assault. There are partner assaults that happen without alcohol, and majority of partner assaults do happen without alcohol. I'm not blaming everything on the alcohol and just letting the men free. Please don't misinterpret it like that. Because when I actually did this short segment on this on Instagram a few weeks before, I think a lot of wokes, because of wokeism, they actually did not understand what I was trying to say, and they were trying to criticize me on this point. But please understand that I'm not saying that it is only alcohol that makes men do bad things towards women. Uh, but alcohol is definitely one factor in many cases. So this is one factor which we can modify. So if partners are not drinking alcohol or are not suffering from alcohol use disorder, then this particular risk can be reduced. So this is a modifiable risk factor, which is why I wanted to convey this message in a manner that you understand, in a simplified manner that you understand, that alcohol is one of the risk factors for partner violence, domestic violence, sexual assaults in women. And also, if you look at sexual assaults in colleges, and this is data from the US again, shows that 15% of college females experience assault while incapacitated in the freshman year. There are a lot of women who get sexually assaulted because of who even when they are not incapacitated. I understand this, but I just want to show you that this is a societal poison. Alcohol is a societal evil, and this is something that we can modify in our lives, and so that we can have much more peaceful lives and a life without danger. And one of the modifiable risk factors is alcohol use. And I think uh, women and men must understand that reduction or limiting or ideally stopping alcohol, and I would definitely want that as an advice. Stopping alcohol can actually reduce a lot of liver related and non liver related risks among women. Now, to summarize everything that we discussed, uh, compared to males, women have a higher risk of developing severe liver disease with lower levels of consumption, development of brain degeneration and reduction in brain size, higher risk of blackouts, hangovers, and incapacitation, higher risk of heart disease and high blood pressure, higher risk of memory-related disorders, uh, poor uh, power in developing new memories and consolidating new memories, higher risk of anxiety and depression, higher risk of cancers, most importantly breast cancer, even with low levels of drinking, and higher risk of sexual assault, domestic violence, partner crime, injury, and accidents indirectly. So all of these are something specific or something special when it comes to alcohol and the woman. And ultimately, I would like to end this session here by saying that there is no safe level of alcohol consumption, because it is not just the liver we are looking at, it is so many other things other than the liver that we just discussed that we need to look at. And higher risk of alcohol consumption or higher risk of breast cancer because of alcohol consumption is one of the most important factors that we need to weigh in, especially when it comes to the woman. So please note that the safest level of drinking alcohol is none, and you have to find ways to say no to any amount of alcohol, just like you find ways to say yes to alcohol. So let this session be an eye opener for a lot of women and also men, uh, to understand how alcohol behaves like a societal evil and how we can actually modify this to improve our lives. So until next time with a new topic, thank you and take care.